Do you know what your doctor isn't telling you about your medical lab tests? This question might seem perplexing, but let's unravel the mystery. Medical lab tests are, in many ways, the unseen heroes of healthcare. They work behind the scenes, silently playing a substantial role in our health journey. These tests are the unsung troubadours who sing the tales of our health in a language only understood by health professionals. They provide invaluable insights into our health status, laying the foundation for accurate diagnoses, guiding treatment plans, and even predicting future health risks. From a simple blood test to complex genetic testing, medical lab tests provide a window into the body's inner workings. They reveal what's going well and what might need a little extra attention. It's through these tests that doctors can detect diseases even before the first symptoms appear. So, medical lab tests are like the unsung heroes in healthcare, quietly playing a significant role. You've probably heard of tests like CBC, lipid panel, imaging, and genetic testing. But do you know what they are for? The complete blood count, or CBC, is a common blood test that measures various components of your blood, including red and white blood cells. It's like a window, offering a glimpse into your body's overall health. Next up, the lipid panel. This test checks the levels of different fats in your blood, such as cholesterol. It's an essential tool in assessing your risk for heart disease. Then we have imaging tests. These include X-rays, MRIs, and CT scans. They allow doctors to see inside your body, spotting any abnormalities or issues that might be lurking unseen. Lastly, we touch on genetic testing. This advanced test can reveal your genetic predisposition to certain diseases, offering a chance for early intervention. These tests each play a vital role in understanding our health and diagnosing conditions. But there's something your doctor might not be telling you. Your doctor is a crucial part of your health journey. They diagnose, treat, and help you manage your health. But when it comes to medical lab tests, there's often a piece of the puzzle missing. You see, doctors are trained to interpret these complex results and turn them into a treatment plan. However, they may not always take the time to explain these results in detail to you. Why is this the case, you might ask? Well, there are a few reasons. 1, there's the issue of time. Doctors often have a long list of patients to see each day, and explaining every single lab result in detail can be time-consuming. 2, they may assume that the medical jargon and numbers might confuse or overwhelm you. And 3, they may think that the key takeaway is the diagnosis and treatment plan, not the intricate details of the lab test. However, this is where patient involvement becomes essential. While doctors are experts in their field, you are the expert of your own body. You know how you feel, what's normal for you, and when something's not quite right. Therefore, understanding your lab results can help you become an active participant in your health journey. But how can you get involved? It's all about asking questions. Don't be afraid to ask your doctor to clarify anything you don't understand. Request a copy of your lab results for your records. Familiarize yourself with the common tests and parameters. And most importantly, remember that no question is a silly question when it comes to your health. In the age of information, there are also numerous resources available to help you understand your lab results. Websites, apps, and even some labs offer explanations and guides to help demystify lab results. In conclusion, while your doctor plays a crucial role in interpreting your lab results, understanding these results yourself empowers you to take charge of your health. It allows you to ask the right questions, make informed decisions, and ultimately lead a healthier life. Understanding your test results empowers you to take charge of your health. Let's delve deeper into understanding these test results. When you receive your test results, you might notice a list of parameters, each with a number next to it. These parameters are essentially the various components that the test is analyzing. For instance, in a complete blood count or CBC, parameters could include hemoglobin, white blood cell count, and platelet count, among others. Each parameter has a reference range, which is a set of values that is considered normal for a healthy individual. This range can vary based on factors like age, sex, and overall health. If your result falls within this range, it's typically seen as normal. But if it falls outside, it could indicate a potential health issue. Let's illustrate with an example. Hemoglobin, a protein in your red blood cells that carries oxygen, typically has a reference range of around 12 to 16 grams per deciliter for women and around 13 to 17 grams per deciliter for men. If your hemoglobin level is significantly lower, it could suggest anemia, a condition where your body doesn't have enough red blood cells or hemoglobin. Similarly, in a lipid panel test, parameters like total cholesterol, LDL, HDL, and triglycerides are assessed. High levels of LDL, often referred to as bad cholesterol, and low levels of HDL or good cholesterol can indicate a risk of heart disease. Remember though, that one abnormal result isn't always cause for alarm. It could be due to temporary factors like stress or infection. Moreover, these tests are often part of a bigger picture. Your doctor will consider them alongside your symptoms, medical history, and other tests to make a diagnosis. So while it might seem daunting, understanding these parameters and ranges can empower you. You become more involved in your healthcare journey, able to ask informed questions and make educated decisions. So with a little knowledge, you can start to understand what your test results mean. Ever heard the saying, prevention is better than cure? It's an old adage that holds true, especially in healthcare. Medical laboratory tests play a pivotal role in preventive care. They're not just for confirming a diagnosis when you're feeling out of sorts. They're crucial tools in the early detection and prevention of diseases. Consider them as your body's annual report. Routine tests like blood glucose levels or cholesterol screenings can alert you to potential health risks before they escalate into full-blown problems. They can spot warning signs of conditions like diabetes or heart disease, often before you even start to show symptoms. But it's not just about the big, scary diseases. Regular screenings can monitor everything from vitamin deficiencies to hormonal imbalances, helping you maintain optimal health. They offer a sneak peek into your body's inner workings, empowering you to make informed decisions about your health. Regular testing can catch health issues early, when they're often easier to treat. Navigating the world of lab testing can feel daunting. Let's make it simpler. So you've got a lab test coming up. The first step is choosing a lab. It's important to consider factors such as accreditation, the services they offer, and their location. Accredited labs follow strict standards, ensuring accurate and reliable results. A lab that offers a wide range of tests gives you more options under one roof. And of course, a conveniently located lab saves you time and travel. Once you've chosen a lab, the next step is preparing for your test. Preparation varies depending on the test. Some tests require fasting, while others might need you to avoid certain medications. It's crucial to follow these instructions to the letter, as they can significantly impact your results. If in doubt, don't hesitate to ask your healthcare provider or lab technician for clarification. Now, let's talk about costs. The cost of lab tests can vary greatly based on factors such as the type of test, the lab you choose, and your insurance coverage. To avoid unexpected bills, it's smart to check with your insurance provider about what's covered and what's not. If you're uninsured or if your insurance doesn't cover a specific test, many labs offer self-pay options or financial assistance, but don't let cost deter you from getting necessary tests. Remember, these tests are an investment in your health. They can help detect diseases early when they're most treatable, potentially saving you significant healthcare costs in the long run. Also, be aware that you have the right to access your lab results. Understanding your results can empower you to take charge of your health. If something seems off or confusing, don't be shy to ask your healthcare provider for an explanation. With these tips, you can navigate the lab testing world with confidence. Let's hear some real stories of how lab tests have made a difference. First, we have Jane. Her routine lipid panel test revealed high cholesterol, prompting lifestyle changes that likely prevented a heart condition. Then there's Alex, whose genetic testing uncovered a predisposition for a rare disease, enabling early treatment and better management. And let's not forget Sarah, whose imaging tests caught early signs of a serious condition, allowing for timely intervention. These stories show the real-life impact of understanding your lab tests. So, what have we learned today? We've seen how medical lab tests, the unseen heroes of healthcare, provide critical insights into our well-being. We've delved into common tests and the importance of understanding them. We've highlighted the need for proactive involvement in our health and how early detection is key. We've navigated the world of lab testing, emphasizing the importance of informed choices. We've heard real stories of impactful tests. Remember, your health is your wealth. Stay informed, and until next time, take care.